My name is Liz and I'm a member of the clinical education team. This series of videos will be specific to creating treatment plans for your clients with substance abuse issues. Our chemical dependency treatment plan incorporates the 6 dimensions of the ASAM rating scale. Let's go ahead and add a new problem. And I'm going to come over here and pick what kind of clinician I am. I'm going to be working this morning as a nurse. And I want to speak specifically to Dimension 1. And I'm going to identify the problem as withdrawal. And the manifestation is autonomic instability with fluctuations in blood pressure and heart rate. This patient also has tremors. Let's come over to our long-term goal. The program has already manufactured that for me. We want an alleviation of withdrawal symptoms, and you need to pick a target date. I'm going to say 2 weeks in all. We're going to move over to our short-term goals. The first manifestation, autonomic instability. I want the patient to be free of symptoms of autonomic instability for at least 2 days. And I'm going to give the patient 1 week to meet that short-term goal. I also want the patient to be free of tremors in the same amount of time. The same short-term goal date. Let's move forward to interventions. I'm going to pick my discipline. Once again, I'm working as a nurse, and we're going to pick some short-term goals and the interventions to go with the short-term goals that we had set up on this tab. We had the manifestation of autonomic instability. So as the nurse, I am going to monitor the patient's physiological status, and I'm going to do that each shift. And I can put down my initials, or I can just say I'm the RN. I also want to monitor my patient for tremors, the status of tremors, and I'm going to be doing that each shift as well. All right, we've set up our interventions for each of our short-term goals. Now we're going to come forward and talk about patient strengths. And I'm going to say my patient has strong religious beliefs. Let's come over to patient barriers. Maybe motivation is a problem for this patient. I'm going to select therapy. We'll focus on motivational problems first and set this in place. Now, if this is the only problem that I want to discuss in this initial treatment plan, I can go ahead and document the status and compile the note. But if I'd like to enter a second problem, you can come back to the active needs list and just click on this button to say add new problem. And I'm going to go ahead here, and as the nurse, I'm going to also talk about Dimension 2, which are medical issues for this patient. And I'm going to say this patient's medical problem is cirrhosis of the liver, as manifested by a prior diagnosis with fatigue and anorexia and maybe esophageal varices. What's the long-term goal? We want this patient to remain stable for the duration of this episode of care. I'll make that long-term goal 2 weeks. Short-term goal, this patient has a prior diagnosis of cirrhosis. I want the patient to understand what cirrhosis is and to be able to explain that to me on a daily basis. And I'm going to put a target date down of 1 week for that. I'm also going to ask my patient to be compliant with their diet daily. And we're going to look ahead at this short-term goal 1 week from today. Let's move forward to interventions. Once again, I'm going to select that I'm working in the program as a nurse and that my patient has a prior diagnosis of cirrhosis. We want him to understand cirrhosis. So this client will Nurse will instruct and have Laura repeat basic information about cirrhosis, including dietary, medication, and need for follow-up medical care. Maybe I'd like the patient to do this maybe 1 to 3 times per week. Put down that I'm the nurse. And we're going to have the patient do the same thing with the dietary. The nurse will obtain a dietary consultation for Laura, and this is going to be done today. By the nurse. All right, let's go over to strengths and barriers. You can certainly update your strengths if you want to. I'm not going to right now. You can update your barriers if you want to. We've just set these up so I don't feel the need. Now I'm going to come into the status area since I've documented on Dimension 1 and Dimension 2. We're working in Dimension 2 right now. Sections 1 and Sections 2 are for follow-up plans only, so you don't need to do Section 1 or Section 2 right now. We can come over here to disclaimers and explanations, and I like this first button here. It says the undersigned clinician or clinicians met with the patient and family as appropriate on the date above in a face-to-face meeting with him or her in developing this treatment plan. If the family wasn't present, you can certainly take this out. Okay. You can also come in here and add some additional details to your treatment plan. If you want to put a SNAP scale in, for example, you could do that, or the BPRS 18 scale. We also have a transition scale, or a transition tab. And I'm going to come over here and say this patient's expected length of stay is about 2 weeks, and the discharge date is going to be April the 5th. Who's the therapist taking care of this patient on our staff? And that's Janina. And who's the psychiatrist taking care of the patient on our staff? And that might be Courtney Kimmel, Dr. Kimmel. I can also do discharge planning if I'd like to. I'm just going to put down here to be arranged. We can detail that later on. I'm going to click continue. And now we are ready to come over and compile this plan. I'm going to compile both plans that we have set up, both problems, review the comprehensive treatment plan to see all problems, strengths, and barriers. If I wanted to just see cirrhosis of the liver, which is the one that we've just worked on, the most recent plan, I could click here and I would see that Dimension 2 biomedical conditions. If I want to see both Dimensions 1 and Dimensions 2, I can click here. Okay, and you can see here, starting at the top, you can see the needs. Dimension 1, withdrawal. Dimension 2, cirrhosis of the liver. This contains your full note. If you would like, if you're not going to be printing off your note and signing it with a pen, you can come over and erase this signature field at the bottom here. Just highlight it, right click, and say cut if you're going to be doing electronic signatures. You also have the option to come over here and set up when a clinical reminder. I'm going to say let's set this up for 2 weeks from today, or maybe 1 week from today. How about that? The 29th. And you are invited to fill in this area too. How much time did you spend with the patient today? This meeting started at 10 o'clock and went until 10:20. And this was an initial treatment plan meeting. You're invited also to put who attended this session today. You can just click here. You're going to get a drop-down menu of everybody on your team. And I'm going to say Joy was here, and she was the nurse. And maybe, let me see here. Liz was here, and she was the psychiatrist. And let's come down here and find somebody else. Let's say Nalini also attended, and Nalini was the clinical director. So if you want to put that these 3 people were present in your note, all you have to do is click here. 1, 2, 3. And now we're going to compile or save this note to a progress note format. The program's going to put up a window saying you have created a new treatment plan. Do you want to set up a clinical reminder? And I'm going to say no for right now, but you can certainly do that. Here's my compiled treatment plan. If I wanted to change the title of this to make it more specific, I could come over here to change note title. And I could say that this note was actually done by the nurse, Liz, and that this was, I could say, for example, the master treatment plan, or I could say this was the treatment plan for dimension 1 and 2. I'm using custom buttons here and here to tweak my note title and who authored it. All right, here's our compiled note. Here's our treatment plan with our diagnosis, current medications, the needs that you've identified. We're looking at withdrawal, dimension 1 first. The needs, the long-term goals, the short-term goals, and the interventions. And then we're looking at our second need, cirrhosis of the liver, with the long-term goals, the short-term goals, and the interventions that you've put in place. Our status text comes next, along with our transition plan, and the patient's plan barriers and plan strengths show at the bottom of the note. All I have to do now after reviewing this is electronically sign it. We'll go back to the chart face, and here's your treatment plan that's been signed for dimensions 1 and 2.